Hi everyone, I am Dr. Bharat Sabu and today we are going to talk about insulinoma. Actually, insulinoma are the most common tumors which arise from the pancreatic islets of Langerhans, and usually most are in pancreas, but distinguishing the location of tumor is difficult at the time of diagnosis. They occur with a high incidence in people aged 40 to 60 years of age, and female are more affected as compared to men. Regarding the symptoms of insulinoma, patient may have anxiety, weight gain, and patient can become excessively obese because he is having a hyperinsulin secretion, and behavioral changes can be there. He can have a clouded vision, confusion. He may present with convulsions. He can present with dizziness also. Any headache can also be a symptom of insulinoma. Hunger, which is usually at times unsatiable. Loss of consciousness can be presentation if it is very severe, hypoglycemia if it is there. A rapid heart rate or tachycardia and sweating, along with tremor in some rare cases. So it can present in all these forms and you need to diagnose it right actually. Regarding history, the history actually historically the three components are there in an insulinoma. One, there should be a symptom of hypoglycemia. Then there should be documented plasma glucose of less than 50 mg per deciliter at the time of hypoglycemic symptom. So the patient is having hypoglycemic symptoms. Along with that, he is having a low blood glucose value which is less than 50 mg per deciliter. And once we administer glucose, all these symptoms are relieved. So all these things are known as Whipple's triad. It is known as a triad which is named after Whipple. So it is known as a Whipple's triad which should be there in patient with insulinoma. Now coming to the causes, what are the causes of insulinoma? It is actually a tumor, as I have told you, in the pancreas which continues to produce insulin even when the blood sugar drops too low, and the high blood insulin level cause the low blood sugar level, and which we know as hypoglycemia. So a hypoglycemia is there due to increased insulin secretion which causes a decrease in blood sugar values. Now this hypoglycemia can be mild, leading to milder symptoms such as anxiety and hunger, or it can be very severe, leading to seizures, coma, and even death in some serious cases. So we need to be watchful for the causes and symptoms. Now some brief about the pancreas. As you can see here, the pancreas is an organ in abdomen that makes several enzymes and hormones. It includes insulin also, which is the key regulator of the glucose metabolism. It reduces the level of sugar in the blood, which is actually the glucose in the blood, by helping it to move into the cells. And when the blood sugar level drops too low, pancreas stops making insulin until the blood sugar level returns to normal. These insulinomas are very rare and usually occur in single, they are very small tumors. So this is actually the pancreas which is located near the duodenum, and it has two components, exocrine and endocrine component, and these are the insulinoma which are there in the insulin secreting cells. Now how we test insulinoma? Fasting test. Every fasting test is started in morning by means of an oral administration of 100 gram of glucose, and we need to continue this fast. We need to check for the blood sugar value, and at the onset of hypoglycemia we take the samples, we feed the patient with some amount of insulin and look for the Whipple's triad. So it may go long, it can go up to 72 hours. That is why it is called a 72-hour fasting test, and that is actually required to make a diagnosis of insulinoma. Along with that, there are certain tests also which are to be done in our patients, like blood C-peptide level, glucose level. We can go for a insulin level check, and we should also check for sulfonylureas or the pioglitazone or other drugs, insulin sensitizers like repaglinide, which can cause the pancreas to release insulin. So these drugs, if they are there, quinine, it can be a cause of hypoglycemia. So we need to check for the drug levels also, which can induce a hypoglycemia. CT or MRI of abdomen may be done for look for a tumor in pancreas. If the test is negative, then we need to go for further testing with endoscopic ultrasound, which is usually very good at picking it. Octreotide scan pancreatic arteriography, and pancreatic venous sampling for insulin if it is available and possible to do. Now, scan actually are done in this manner. You can very well see the ultrasonography and the MRI scan. Regarding the treatment, surgery is recommended treatment for insulinoma. The tumor is first found by test, or they are incidentally detected during surgery. If they are a single tumor, it should be removed. If there are many tumors, most part of the pancreas will need to be removed. That is known as partial pancreatectomy. And 15% of pancreas must be left by surgeon to produce its enzyme. This may prevent the surgeon from removing the whole insulinoma tumor at some times. Now, if no tumor is found during surgery, we can prescribe patient the drug diazoxide to lower the insulin production and avoid hypoglycemia. A diuretic should be given to patient to prevent the body from retaining fluid, and octreotide has shown to be of some use to reduce the insulin release in some patient. With that, I thank you all with these references for the patient listening. Thank you.